Folks, this is the meeting for the Central District Board of Health for Friday, May 12, 2023. It is now, what time is it? My watch.
10:30.
It's 10:30 a.m. Thank you, Russ. We'll call the meeting to order and start with the roll call by county. Dr. Young.
Jane Young here.
Dr. Cole. Raul Labrador.
Here.
Boise County Commissioner Tucker.
Here.
Elmore County Representative Blanksma here. Valley County Commissioner Hasbrook.
Commissioner Hasbrook here.
Okay, thank you, folks. We do have an agenda. We are quorum. We will proceed with the agenda. We do not have any public comments this morning, so we will proceed with new business. And we do need to entertain a motion on the minutes from our April 21st board meeting, if there are no corrections or discussion.
Madam Chair, just one quick comment. One of the things that's coming out now that we're trying to do a better job on commissioner level is after an executive session, you need to state that as you come out of executive and then there's a motion, you state that motion, or you have to state that no action was taken. So I'm guessing under number 2 on our executive, it just says back in regular session. In the future, I think we need to state that no action was taken, or there's a vote to fire somebody, but you don't use names or anything like that. You have to have what happened from that executive. Does that make sense? Yeah. So maybe in the future, we could make sure that that's included after the executives are over.
Okay.
Just more of a maintenance thing.
Okay. Thank you, El. Okay, the motion has been made to accept the minutes as presented with discussion for future minutes. Is there a second?
Second.
Thank you, Jane. Okay, we will proceed with a vote to approve those minutes. Dr. Young.
Jane Young, aye.
Dr. Cole. Raul Labrador. Commissioner Tucker.
Sorry, I was muted. Aye.
Okay.
Commissioner Tucker, aye.
Elmore County Representative Blanksma.
Aye.
Valley County Commissioner Hasbrook.
Commissioner Hasbrook, got it.
Okay, those minutes do stand approved as presented. Next on our agenda is report for our financial situation by Laurel McMahon. So Laurel, go ahead.
Thank you, Madam Chair. So I've got the budget to actual report through the end of April of this year, which is about 83% of the way through the fiscal year. Not much has changed since we met 3 weeks ago. So I'll give a brief update, but things just from a high level view have continued on the same trajectories that they're on. For our expenditures, we're still below planned amounts, and for our revenues, we're still above planned amounts. Kind of the same thing we saw when we met last month. Over the last month, our revenues increased by about 5% and our expenditures increased by about 9%. And as we talked about last month at this time of the year, it's typical that we've received most of our revenue. So that's growing more slowly than our expenditures. And typically they get a little bit closer as we approach the end of the program year. Looking more closely at the revenues for CEH, for community environmental health, our fees are at about 88%. For FCS, we're still slightly behind at 76%. And as you saw with our budget proposal for FY24, we're only expecting a small increase in fees for next year, less than 2%, knowing that our fees have been pretty close to our planned amounts for this year. Our contracts, both over planned amounts in family and clinic services and community environmental health. Our other expenses are above our planned amount. Again, we moved some money between contracts and other at the budget revision. And then, as we mentioned, our total revenues are at about 89%. For the expenditures, our personnel budget is right on track where we were last month, very close to where we expect to be percentage-wise. Operating and capital continue to be under planned amounts. And as a reminder for capital, that's the bathroom remodel project that hasn't started yet. We did have the bidding on that closed yesterday. As far as I know, there was only one successful bidder, so we'll be ready to move forward with that project relatively quickly. So then overall expenditures, again, about 77%. So there's a gap of about 10% between, what we're taking in for revenues and expenditures. Anticipating some carryover this year. Just preview for what will come in our August meeting. Looking at page 2, here's our comparison between the last 2 fiscal years for our fees. Same as we've talked about the last couple of months, we continue to be above where we've been for the past 2 years. The big increase there, as we talked about last year, continues to be in food programs and community environmental health. And just over the last month, since the last time we met, we took in another couple $1,000, or actually $20,000. My decimal wrong there for a second, $20,000 since last month, and it just continues to be our biggest source of fees amongst both programs. Our contracts for both are above where they've been, significantly above where they've been the last couple of years. That's about what we're planning again for next year. Revenues, as you can see, we talked about fees already. They're slightly over, very slightly. And our contracts are about 10% over our planned amount. Personnel costs are slightly under, as we looked at on the other page as well. And then we've got operating, T&B, and capital all under our planned amounts as well. And no changes from what we saw last month. Yeah, the cash balance statement. Total cash balance at month end through April was 10.5 million. No change in any of our reserve fund designations. Special projects all stayed the same over the last month. The reserve fund, operational reserve, and then our capital reserve as well are all the same. Total there is 4.5 million. We have 3.5 in restricted funds, and then that leaves us a total undesignated cash balance of about 2.5 million. Any questions or comments on the budget to actual report?
Madam Chair.
Yes, go ahead.
Laurel, on the front page, county contributions were short just a hair under $1 million. When do you get the last of that? Is that in June after tax collections?
We get,
Asked this before, but I don't remember the answer.
Madam Chair.
Yes, go ahead.
So all of the counties are on their own schedule for that. Some pay quarterly. Ada pays twice a year, and we actually get the second payment for this fiscal year in July in FY24. So yeah, that's part of the reason for
What
that.
about Valley County? I don't know what we do.
Valley, I
We do.
don't know if you're quarterly
Twice
or
a year?
3 times a year. I'm not sure. I had a schedule printed out, but I didn't bring it for this meeting. But for the counties, we send one letter at the beginning of the year rather than invoicing, and they pay on their own schedule. And because of our cash balances, that hasn't been an issue. I know it's been a discussion that we could establish a frequency or regularity and invoice on that basis, but we haven't, at least from a cash inflow point, haven't felt the need to do that from our perspective.
Well, I guess the base of my question is the fact that if the county has that money or we have the money, they're collecting interest off it, whoever. So maybe we need to think about some kind of parameters or when we get that money. I don't know. I'm just throwing out ideas here. The other question I had is further on down that same column, county contributions timing offset. What does that mean?
So we talked about that during the budget revision
And I've
meeting.
forgotten, I'm sorry.
Yeah, that's okay. It's a little bit complicated. I would like to forget myself, but that's because we get the second Ada County payment in July, which is in FY24. And since our accounting is on a cash basis, we have to count it as income in FY24. So we put that money in what we called, we haven't had to do this before. The reason we had to do it this fiscal year is because it was the end of the state money. So this is the year that there's the lag. So we called it the county contributions timing offset. After next year will be on the
This
next
should all go
schedule.
away next year.
Yeah,
Okay. Okay, so that's just due to cash flow.
yes.
Madam Chair, I have one more question.
Yes, go ahead.
On the second page, fees under the food programs, that has gone up 200,000 in 2 years. It's about 100,000 a year.
Yes.
Are we staffed for that? Handle that much growth in that?
Madam Chair,
Yes, go ahead. Russ.
Commissioner Hasbrook, we are, we, as the number of licensed food establishments increases, then we have our inspectors do approximately 300 licensed food establishment inspections per year. And that's required by law, 1 annual inspection plus all the follow-up inspections, and
300 district-wide?
so each inspector
Oh, each
Yeah,
inspector, okay.
does about 300 food establishment inspections. So what we typically do is you basically get, like any business, you get to that point where you have staff doing more than that. And then eventually we bring on another environmental health inspector. So we have more revenue coming in, as we've talked. Probably about 2/3 of that is now covered by the county. So as our number of inspections go up, our fee revenue increases, which is what you're referring to.
Mhm.
But the fee revenue only covers about a third or 40% of the cost to do the program.
So are there parameters somewhere in our policy that says once you do 300 inspections, that trips us hiring another inspector? We have to do that with public defense and attorneys, the caseloads and all that stuff. They reach a point, okay, that's the trip lever that we got to get another attorney.
Madam Chair.
Yes, go ahead.
Commissioner Hasbrook, generally, so we have an environmental health team that does pools, childcare, food inspections, and then we have inspectors who do a lot of the land development work. So within the team that does childcare, those individuals also have the ability to assist with food inspections. So we don't have an exact mark when you get to this point, but we just
cross-train.
Right, we'll bring somebody new on, and it takes a period of time to bring them up to speed unless they have, for example, came from another health district, then they're ready to go to do the work. If they were food inspectors in District 3, then the day they're hired, I mean, we go through some training process to familiarize them with CDH and how we do it. But there's not a specific formula if you get to this point, because we'll just shift responsibilities around, or at some point in time, like in 2008, we had the recession, the housing recession, which we would then have some of the inspectors who were previously doing land shift over and help with food. Supervisors like Mike Reno on land and Natasha Fernie both have the ability to do the work too. So we don't, our goal is not to overwork our staff, and we monitor that too. They can work overtime, and occasionally they have to. And we just try to, manage that from that perspective.
Well, it's kind of apparent, Madam Chair, it's kind of apparent in this budget that your sewage disposal is down about 70. So you've taken those inspectors and use them for food.
Madam Chair.
Yes, go ahead.
So we do have the ability to do that. I'm not sure exactly what we've done just yet. So sometimes that fee revenue, it can decline. I mean, this is year to year comparison, but like we all know, there was a lag this year in rural county land development, especially Boise County and Valley County, where most of those lots are on septic systems rather than city. And then that we know, because of the snow, it's going to pick up, and it already has. I know in Boise County, we thought it was going to slow down, maybe. And then as the snow melted, then people's interest in getting their lots developed went right back where it was. So I think part of that's a little bit of an anomaly due to the heavy snow year we had.
Late spring.
Right.
Yes, that's a big difference.
Right.
Okay, thank you. That's all I have.
Okay, any further discussion or questions for Laurel on that? If not, Laurel, go ahead and proceed with your next agenda item.
Thank you, Madam Chair. So next up is our FCS and CDH fee schedules as proposed for fiscal year 24. Just quick overview of our fee development process. So as you know, we adhere to state statutes or rules for any relevant program requirements that there are. If there's federal program rules, or if these are set in statutes, then we accord by those. In addition to that, in setting fees, our division administrators and program staff and our finance staff meet and consider what the current costs are for providing services, reasonableness of fees compared to other entities that are similar, standard reimbursement amounts for third parties. We look at for clinic fees, and then for the clinic also we consider the client's ability to pay. So looking at our environmental health fees today, you can see that many of them have increased. We'll go through them line by line, but the first page includes most of the fees that we have the ability to set based on our current costs. And the second page, when you see the single asterisk by any of those fees, those are the ones that are set in law. I will say, when you look at these increases, some of them appear to be big increases, some of them are big increases. Our actual costs for FY '23 were higher than what our proposed costs for FY '24 show on the sheet. And the reason for that is we had some of our higher paid staff traveling and performing the work. So we know that they were artificially inflated. So we moved them back down to the fees that you see here. We moved most of them down from what our actual costs were during fiscal year '23.
Madam Chair,
Yes, go ahead, Megan.
so you're telling me if you go down to central large soil absorption system new or repair, where it's gone up $600, that is actually decreased from what was actual in 2023?
Yes,
What was the fee in 2023, or what was the cost in 2023?
I don't have the actual costs with me, but I can get that number for you.
Madam Chair,
Yes, go ahead.
so the second question would be, how did you determine the $600 increase then? Have you staffed up so that the higher paid supervisors, whatever you want to call it, are no longer doing the permits, or is that still built into the fee?
Yes, we have staffed up specifically in Valley County so that we now have a health inspector doing the work rather than the supervisor,
Difference in salary
and travel.
and travel, yeah.
Madam Chair,
Yes, go ahead.
just for a comment, that's why I would be curious as to see what the actual was. If a supervisor was doing it and was traveling and it was higher than the 1650, then what did it come down if now we don't have travel and now it's just not just a health inspector, but just it's a health inspector job, not a supervisor job. There's no metric. It's not explained to me, I guess is what I'm saying. Is there's no way to tell that you've brought it back because you've staffed up for lower paid personnel.
Mhm.
And that's a concern, because that's $600. I mean, that's not a small increase. None of these are tiny increases. And if that's true, if the increase is actually a reflection of what the costs were higher in 2023 than anticipated because we were using supervisors and there was more travel, but now we're not going to use supervisors and more travel. I'm trying to figure out what the methodology was for increasing the fees and then presumably backing them down, but we can't see any of that here.
I can show you that. I can provide that, the actual costs.
Because I don't feel comfortable approving these without that understanding, quite honestly.
So for when we set the fees, the meeting doesn't include the program staff, so the person who was traveling and performing that work. There is an element of estimation in there. That fee was one in particular that was backed down. So there is an element of estimation. But I can provide what the actual costs were. That's easy to bring to the group.
Madam Chair.
Yes, go ahead.
Yeah, my concern is that you want us to approve these, but we don't have that data. And I'm just letting everyone know, I don't feel comfortable approving fees that I can't explain.
Madam Chair,
Yes, go ahead, Al.
Laurel, on the front page under the child care.
Mhm.
The big issue in our county, and I don't know, it's the rest of the counties, is we just don't have enough child care. Is this the basic, the bottom line we can do for these inspections to try and encourage, or can we get these a little bit lower? The one question I had is the Boise City license. Are we collecting those fees for Boise City?
That one is not in statute. And I don't know, Russ, do you know why the Boise
Bottom
City
page of the
licenses
front.
are
One.
different
Page
for
one.
childcare, or
Yeah.
Curtis, do you?
We do, Madam Chair,
Okay.
so we do collect license fees from the providers. So in this case, the city would require, most of those would also be licensed through the state. The city has their own requirements, which requires that we do an inspection. The city licenses them, but they're essentially the same rules with a few exceptions. So the city pays us to do inspections, and then any balance, any difference, whether it's city or outside the city, we collect that in contract revenue from health and welfare.
Oh,
That doesn't really make sense
No.
because city's getting a cut of our inspection, basically.
Mhm.
Madam Chair.
Go ahead.
I'm sorry.
That's okay. The city, some cities have their own childcare licensing requirements that are more strict than what the state requires. So the inspections are being performed by our staff. If the city didn't license them, the inspections would still be performed by our staff. So they're still licensed. They're just, their rules are more strict than the state rules.
Madam Chair.
Go ahead.
So question along that line, then if their requirements are stricter in obviously city of Boise, nowhere else it doesn't appear to be, then it takes additional time. So are we billing the city of Boise for that additional time to do their more extensive inspections for their particular license?
Madam Chair.
Go ahead.
No, we don't bill the city for extra time, and I'm not sure, as far as time studies, how much extra time it actually takes. I don't know the details of what all goes into the inspection as far as what the specific differences are.
And Chair, I think my concern is that we're collecting a fee for Boise City, that they don't have any expense other than just maybe to register them so that everybody knows on some website that here's all the daycares. I don't know that detail, but I do know that these fees are discouraging daycares.
Mhm.
They can't afford it. So some of them are doing it under the table, especially the family, the smaller 3 to 5 kids kind of groups. Nobody even knows about those. And I'm not saying that's the right way to do it, but I think we need to really look at some of these, and I'd be interested to see what exactly are we inspecting? Is this, you inspect the kitchen? Do you inspect, adults per child ratios, or what all that entails? And it's a really, especially in our area, a big issue because nobody wants to do the daycare because of the fees.
Madam Chair. What I would suggest we do based on the questions and the information that the board is requesting is that we table the environmental health fees for today and reconsider those at the August board meeting, and we'll be more prepared to provide the specific data, and we'll have the staff present that can explain the differences in inspections and how the fee structure works. And we should just move on to the family and clinic service fees for your consideration today.
I would have one comment, Madam Chair.
Yes, go ahead.
Since I won't be here in August. I think that for rural counties, these sewage permits are particularly significant
Yes.
and a problem if we're gonna increase by these kind of quantities. Particularly since income levels generally out here in rural areas are not as high as they are in the city of Boise. Just facts. And so I would hope that due diligence is done on those increases since I won't have a chance to review those. So that's discouraging to me. That data is not available when we're here to vote on it. The other thing I would like to say, since this is it for me, that it would be nice if the board would review the subdivision applications and how the permitting is done for septic on that, because and I'll be looking in statute for it, because there's ways apparently that people can use the Board of Health to get around planning and zoning for lot sizes and permitting on septics. So just a heads up.
I would also be interested to know too, particularly on the sewage fees, because we're seeing big increases in here. Are the other agriculturally dominant areas seeing this huge increase as we are in other districts? So,
Yeah, I'm sure. I don't know what
Right.
other districts charge, but we can have that by August for sure, comparison and the actual costs.
So if, Madam Chair, if you need a
Yes.
motion, I'd motion to table the environmental fees until time certain, which would be the August board meeting.
thank you, Megan. The motion's been made to table the environmental health service fees until the August meeting with further review. Is there a second to the motion?
Madam Chair, before I second that, I think it would be really nice, maybe Laurel, or I don't know how to handle this, but if we could like the childcare inspections, if we could see some of that, what they actually inspect. before the August meeting. Cause it's hard to sit down in a meeting and try and read all that 10 minutes and vote on something. And I agree with Megan on the sewage deal. This is gonna hit a lot of people. They're gonna come to commissioners and scream about these fees.
Yep.
And, I think we gotta be very careful. I don't know, it's like the food fees. How far do we wanna subsidize these fees for certain things? And that's a question that each commission's gonna have to answer themselves. I just know that talking to folks on the daycare situation, they can't afford the fees. So I'll second Megan's motion.
Okay, thank you, El. The motion's been made and seconded that we table the environmental health services fees until the August meeting and have provided more information. Is there any more discussion before I call for a vote by Kim? Okay, starting with Ada County, Dr. Young.
Young, aye.
Dr. Cole. Raoul Labrador. Commissioner Tucker.
Aye.
Representative Blanksma.
Aye.
Valley County Commissioner Hasbrook.
Hasbrook, aye.
And I will vote to aye on that also. I think we have two members that were just, are they muted?
No, Raul said, aye.
Oh, he
I
did say
said aye.
aye. Okay, I missed that. Okay, thank you.
His trigger finger on the mute button isn't what it should be. It's out of
All right,
practice.
so we'll hear more about those fees in August. Okay, go ahead, Laurel.
Okay, so, the next set of fees, thanks, Madam Chair, are the family and clinic service fees, and as you can see, there were not many changes to these fees. A few, on the first page, everything stayed the same. On the second page, most things stayed the same. Some went down by, $5 to $10, but for the most part, these are about the same. And then on the last page for clinic fees, we had the second, third, and fourth line, our phone consultations, those we went down more significantly. And that was one of the things recommended by our division administrator, Stephanie, that those, because of the ease of those visits and the fact that they're over the phone, to make those fees lower than they had been in the past. And for our clinic fees, the way that we set them is a little bit different. We use a formula that includes CMS updates, RVUs, and a conversion factor. When that's not available, we used 2% of Medicaid's, or sorry, 200% of Medicaid's fee schedule. We times it by 2. That's how we establish those. We also look at what our actual costs were, and the note on that, our FCS staff has been fairly consistent. We've had some salary savings there this year, so we think that that went into how we're able to keep costs the same there.
Madam Chair.
Yes, Megan. Go
Okay,
ahead.
question about the dental. Is that 200% Medicaid, that increase, or what is?
On the risk
On-
assessment, the high.
No, just all of it.
All of it?
We are now rounding. There was change before. Yeah, this is a multi-pronged question, so I guess I might as well throw it all out there. How many of our visits are under the age of 18? And how many of our visits are adult Medicaid visits? And are these dental charges reflective of the reimbursement rates for Medicaid, or are they calculated in a different way?
Madam Chair, I'd actually like to defer to Stephanie on that. I'm sure if you know the.
Yeah, lots of questions there. So the first one, how many visits? We do not see adult visits.
Okay.
They're all children's visits. I think there was a mistake possibly in the past year where that $20.40 for the low moderate was the reimbursement only for that line, but it was on the 3 lines.
Okay.
So we do kind of a combination of Blue Cross and Medicaid's reimbursement rates. So those are more closely aligned with Blue Cross's reimbursement rates.
Okay.
I think I missed another question you had, Megan.
No, as long as you're, I'm sorry, Madam Chair, I'm just making sure that you aren't doing adult dental, because I don't know how long that's gonna last.
Madam Chair,
Yes, go ahead.
Stephanie, what is a prophylaxis? I don't know what that is. The third one from the bottom,
Cleaning.
that's just cleaning.
Yep, it's
Hey,
cleaning.
maybe for dumb farmers, you can maybe kind of explain that a little bit. You knew it, but I didn't.
Madam Chair,
Yes, go ahead,
a
Jade.
couple questions. Is the phone different than telehealth then? And we're not doing telehealth and we're just doing phone?
Madam Chair.
Yes, go ahead.
Yes, the phone is different, so it's rare we do phone visits anymore, it's all telehealth. And reimbursements have changed, so originally when COVID happened, phone reimbursements were the same as an office visit, they
Mhm.
retracted that back.
Right.
So there's not a lot of, I don't think hardly any phone visits anymore. So it's not the same.
So the description of phone is, should be tele.
No, it's just on the phone, telehealth would be a video.
Right.
It's what we do. We don't do any phone
Where is
visits.
Where is that then?
That would be the same as the office visit. I'm qualified the same.
The telehealth is under the office visits.
That's
Yeah.
correct.
Now I have like way more questions.
Yeah.
Go ahead.
So do we have that on there, Stephanie?
It's just standard office.
So a video visit or
Mhm.
office visit has the same CPT code. So it's 99201, a new problem visit. We would bill that the same, but then billing has a modifier down at the bottom. Where we put in like a code 11 that shows that it's a telehealth visit. Place of service.
Madam Chair.
Yes, go ahead, Megan.
So basic coding, right? I get it. You're coding the same for an inpatient or in-person visit as a telehealth visit. But Idaho code, I know for a fact, states that I can make the phone call. So really, if I'm going to save money, I'm going to call you and I'm not going to do a video.
Right.
That's the smart thing to do. I'm just saying. Is that accurate?
Yes, go
Or are you refusing to take the phone calls and requiring the video?
We have not had a high need at Central District Health to do over the phone. Our providers usually want to do a review of systems, or want to see the patient, depending on what that visit could look like. However, if we just needed to discuss lab results with someone and answer questions the provider did, a phone visit may be more appropriate. We just don't find that we utilize those phone visits a lot now. I don't think we've done any in the last 5 months at all.
Okay, Madam Chair.
Yes, go ahead, Megan.
Yeah, I have concerns about that type of availability, knowing that the internet is limited out here, Boise County, out rural Elmore County, and that I'm concerned that if we can't do the phone outreach and all of it has to be via video, because I know from my house, unless it's a good day, it's not happening. It's going to be over the phone. And we fought real hard to make sure that that was in statute. So if we're in some way discouraging that I would find that to be problematic, I guess.
Just like you said, though, there's a separate code for if you tried video and it didn't work, then you go to the phone. So you can show that with your coding.
Right. My comment is just that if it's a deliberate effort by the providers to get away from the phone calls, that is a concern, I think, and a cut in access. I got to get it all out this meeting because this is it.
Madam Chair, I had one more.
Yes, go ahead.
With the 201 and the 212 and the 2 blah, 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 I thought those all shifted down this year. So that they were corresponding like the 204 was 214, where last year it used to be opposite.
What are you
That
talking
would make
about?
sense. Down on
Right.
the second page,
Oh,
halfway down, 2/3 of the way down. Like where it says, new expanded problem is a 202, then the expanded problem down below says 213. I thought it was that they were corresponding this year. I don't know, but if somebody would
Keep an eye on
check that.
coding. See, nothing's more fun than medical codes.
No.
and here,
Yes.
I have another dumb question. I don't know, Steph, or who to ask this for, but because we have kind of an outbreak, STD outbreak, where is all that treatment in this?
Madam Chair.
Yes, go ahead.
Depends on the treatments. So some of them are injections. I don't believe we have any of our injections listed for medications on this fee list. Those are for office visits, depending on the treatment. Like when we look at chlamydia, that's a nurse visit. The nurse visit is not charged, but the medication is a charge.
Okay.
And that can vary depending on the cost of medications.
So it's a visitation charge, not an injection or a medicine charge.
We don't do a visit charge for the treatment. We will charge an initial office visit and then the testing, to see which SC. And then the treatment is usually no charge. It's, they come in for a nurse visit to give them an injection or give them oral pills to take.
And which one is that on this list?
I don't believe any of our medications are listed on this. There is an injection fee, the second page about midway down where it says,
Oh, yeah, 372.
Yeah, where there's the injection fee, that doesn't include the medications, that's just the injection and the cost for the nurse to provide that injection.
Thank you.
We ready for a motion?
Laurel, did you have any more to add?
No further comments.
Okay, all right. Okay, yes, we're ready for a motion.
Motion to approve the family and clinic services fees post for 2024.
Okay, the motion has been made to approve the family's service fees for 2024. Is there a second?
Madam Chair,
Yes.
the coding needs to be corrected, I think, before we decide that, because the fees go
Yeah.
along with the coding.
Mhm.
So do
Would
you,
it be possible to have that in August for us? Clarify those things.
so you want me to make a different motion to table it along with the other fees?
Yes.
Okay, then I move that we table the family and clinic services fees until the August meeting. I'm certain.
Is there a second to that? Okay, there's a second. Any further discussion?
I think we should amend the motion that Megan's got to be there, make sure we're. Do that.
Let me see what I can push down the road.
Okay, the motion's been made and seconded. I'll call for a vote by county, starting with Dr. Young,
Jane Young, I.
Dr. Cole, Raul Labrador. Okay, Raul Labrador.
You said
Aye.
Boise County Commissioner Tucker,
Commissioner Tucker, aye.
Elmer County Representative Blanksmore,
aye.
Valley County Commissioner Hasbrook.
Commissioner Ashbrook, aye.
Okay, that motion passes and we'll look forward to those changes in August. Did you have any more to say, Laurel, on any of the fees? Okay. Okay, then I guess we go to the cost by county report, for Laurel also.
Thank you, Madam Chair.
Mhm.
This one does not require a motion, so it should be a pretty quick overview. So this was requested at last month's meeting, the fixed cost by county. As we mentioned during that meeting, this is an estimate and some of the Ada County fees or some of the numbers that went into Ada County are actually people who perform work in Boise County on an itinerant basis. So those numbers will be reflected in Ada County. The things that were included in this, clearly we got salary, benefits, operating. It also includes any facilities projects or equipment that was ordered specific to one facility. Costs exclude trustee and benefits, which is any kind of subgrants or subcontracts that we're doing with community partners. Our total budget for FY '22 was a little over 3 million more than what the fixed costs were. And that represents almost all of the work that we did with subgrants and subcontracts working with our community partners that year. That was opioid, COVID, and then those were the two biggest subgrants or subcontracts that we worked with that year. And there were some other smaller ones as well. And we did, so the numbers that we got for salary and benefits for Boise County, those are staff who regularly work there, mostly land program or doing other inspections. The staff who work there just very intermittently, like WIC staff who may have gone up, would be included in the Ada County cost. And then just a note on operating, since those staff that perform work in Boise County are assigned to Ada County, have offices in Ada County, their overhead is assigned to the Ada County costs as well. And that's all the information I have on that. Cool.
Questions, discussions regarding the cost by county?
Madam Chair, I just had a quick question for Laurel.
Yes, go ahead.
Laurel, let's take Valley County, for example, the salary and the benefits, I'm assuming are medical and social security and all those taxes. And normally we figure about 30% of a salary on top of it. It's those benefits. In this case, it's about almost 50%. So that's telling me that the benefits that those employees are getting should need to be judged at a higher value. This would scare me as a commissioner if I had 50% benefits.
Madam Chair, that is what our benefit rate, our fully loaded, fully burdened cost for employees has been running.
And just so you guys know, we were notified the other day that Gem Plan is asking for a 9.5% increase in premiums this year, and they had 11% last year. That hits the counties right in your face, so.
Well, and I think previously we have discussed at our meetings on retention and everything, that we try to be a little bit higher on our benefit package rather than the salaries, correct, to retain employees. Yeah, because our salaries were still under.
Correct.
Yeah.
And Madam Chair, did we have a salary survey? Are we in that process now? HR?
Go ahead.
Madam Chair, Commissioner Hasbrook, so we use the state system and they do salary surveys. I'm not sure the frequency, but they did them last year and they did them last year. And then the salaries that apply to this year, they use Korn Ferry Hayes. And then we use Robert Grifford. He did our salary survey last year, which was the first time we engaged somebody in the private sector. And we made some adjustments there. And then the state, once again, as I noted, did a survey this year. And we had Robert Grifford review our positions. And they very much aligned with what the state's adjustments, which it's not a surprise because Korn Ferry Hayes is a very large organization that does this nationally. So in the end, I guess the conclusion is our salaries do remain further behind the private sector. And that's why we try to give pay increases every year. I know this year is not a significant increase, but it's an increase. And we're always sensitive to the money we receive from the counties, and the rest of the money is either fee revenue, which we just talked about, or to a great extent, federal tax dollars.
Okay.
Okay. All right, any further comments, discussions? If not, we will proceed with the next agenda item for board elected positions, to include chair, vice chair, trustee, and executive council member. So. Sure, yes, go ahead, Jane.
I move to nominate Elt for chair,
Okay,
yourself for trustee.
it's been moved to nominate Elle for chair. Is there a second?
Second.
Okay, moved and seconded that we have Commissioner Hasbrook as our next board, District 4 chair. I'll call for a vote by county starting.
Chair, her motion
And
included
trustee.
the trustee.
Oh,
Included you.
oh, include trustee? Yeah, I'm sorry, I was here in chair.
I seconded it, so away we go. 2 with 1. I'm good.
All right, okay. Do you want me to restate that, or is it? Yeah, the motion, clarify, the motion is for the chair position as well as a trustee.
What do we also are gonna put like the vice chair?
Yes.
Okay,
Yes,
good.
yes.
Did we have a victim volunteer? Because we could just put it.
Look at.
Good to know.
Okay, let's go ahead and call for a vote by county on the chair and the trustee positions, starting with Dr. Young,
Jane Young, aye.
Dr. Cole,
Aye.
Raul Labrador,
Aye.
Boise County Commissioner Tucker,
Mr. Tucker, aye.
Elmore County Representative Blanksmont,
Aye.
Valley County Commissioner Hasbrook.
I'm still thinking about it on.
We don't need him. Just keep going.
You don't need
Put me down as abstain. I don't like it for myself.
Okay, all right. Okay, and as chair, I will vote aye. Okay, congratulations. Okay, that leaves a
Vice Chair.
vice chair. That's where, yeah, that's where I was going.
And can I clarify real quick?
Absolutely.
So vice chair, the positions you just voted for, chair and trustee are in Idaho code. Vice chair is also in Idaho code, and the other position that's not in Idaho code is the executive council member. So that person represents the health districts at the Idaho Association of Local Boards of Health. Typically, that is, for our board, it's always been the trustee that serves that role also. So I just wanted to put that out there before you vote for vice chair. I don't know if you want to also discuss the executive council position at some point as well.
Madam Chair,
Yes.
personally, I think we should do away with the term trustee and call them an executive council member,
I would agree.
because there is no longer a trustee.
I'll be happy to make that change.
But
But
Madam Chair,
Yes.
currently Idaho code says every board will have a chair, a vice chair, and a trustee.
Madam Chair.
Yes, go ahead.
Yeah, this brings up the same point that I make annually, if not more than annually, in that one, the Association of Boards of Health should be completely voluntary and they shouldn't be able to assess us and force us to pay anything because we no longer need that trustee position because now the counties are footing all the bills and they are not responsible for the state allocation. So really, the trustee is unnecessary at this point in time. And I know someone who's looking at finding a way to eliminate that from state code. But until then, you need the named trustee. So there you go. There's my 2 cents. Again, I'm on my way out the door.
we can do a trustee / executive council for now until the trustee thing comes off the books.
Well, that's kind of how you've acted on behalf of, even though the trustee thing went away.
Yep.
Yeah. So. Okay, so I will open nominations for vice chair.
Madam Chair, I would like to make a motion, or I'd like to nominate Mr. Clay Tucker for the vice chair position.
Second.
Okay, the motion's been made and seconded to nominate Commissioner Tucker as vice chair. Any discussion?
Now's the time, man, if you don't want.
Yeah, this is your chance,
I
Clay.
said I'd rather not.
He just got on the school board too, so he's
Oh,
got, he's
boy.
piling up.
It's not tough. As long as you make sure Elt shows up. You're golden.
I can do that.
Okay, I'll call for a vote by county, starting with Dr. Young,
Jane Young, I.
Dr. Cole,
Aye.
Morale Labrador, Boise County, Commissioner Tucker,
I will abstain from this.
Elmer County Representative Blanksmont,
Aye.
Valley County Commissioner Hasbrook.
You bet.
Okay, congratulations, Clay.
Thank you.
Okay, that brings to a conclusion.
This is Raul Labrador. Aye.
Okay, thank you. That brings to a conclusion, board positions, and we're going to move on to the director's report. Russ?
Thank you, Madam Chair. My report will be brief. We have the Idaho Association of District Boards of Health annual meeting on June 8th, 9th, and 10th in Coeur d'Alene. Public Health District 1 is hosting it this year. I think right now we have 3 board members who plan to attend. And if you do not plan to attend, you should have already received a proxy from Donna. And you can provide that to any of the 3 board members who are attending. Commissioner Hasbrook, Representative Blanksma, or Betty Ann Nettleton, if you would like to have your vote counted at that meeting. Last is, before she makes her way out the door or off the board, I suggested we get Representative Blanksma a plaque. And Donna said it probably won't make it all the way to her car. So of course, in Donna's form and fashion, she prepared a little.
Ouch, Donna. You didn't need to do anything.
I think we need a speech.
Yay.
Speech.
No, oh my gosh.
Back.
Well, thank you. That's really nice, Donna. You guys didn't need to do anything. I appreciate it though. Thank you.
And Megan has been on the board. She joined in about this time in 2015. So she's put in 8 years of hard labor. And, now she'll move on to, she already has moved on to lots of other things, but
I've got other side hustles.
yeah, so you
Yeah.
want to say anything?
No, I have appreciated my time here, some more than others. I'm looking forward to moving on to other things. Obviously, I'm always happy to help. I've got, my legislative district has changed, obviously now. I have both Boise and Valley and Elmore, which makes it more of a challenge for me to just represent Elmore on this board. And so that's why, since I was terming out, it's time to go. And so I wish you all the best of luck. Call me if you need something. Hopefully my voicemail's not full.
Do you take emails or texts?
From some.
Yes, Megan, I want to appreciate my appreciation for you being my other county cohort and you've helped us with a lot of difficult situations. And it's, I think, really in the interest of public health that you have been a great asset.
Thank you.
And it's been a hoot.
Oh, you're not done with
Yeah.
me. Neither is Commissioner Tucker, unfortunately. You guys are stuck for now.
Okay. Always a seat at my table.
I will remember that.
Okay, any more speeches for Megan, or Megan, are you through with your speech?
I'm ready to go. I got another meeting here that I gotta get to in Boise, so
Okay.
thank you. Appreciate it.
Donna, what day in August is our next meeting?
Yes, I still write that down. The 19th.
August 19th.
Let's see, 18th, sorry.
Okay.
Right, the 18th.
Okay. This brings us to the conclusion of our agenda for today's meeting, so I will
You guys will find me.
to entertain a motion for adjournment. And prior to doing that, I want to let the public know that we appreciate anybody who's participated, listening in. I don't think we have anybody in-house today. But our next meeting is 8:30 a.m. at our Boise office, and that will be August 18th. So I'll entertain a motion for adjournment.
So move.
Second.
Yes, discussion.
For the next meeting, if it would be possible, I'd like to put on the agenda that we have a discussion about going back to in-person meetings.
Okay. Noted. Okay, thank you. The motion has been made and seconded. I'll take a vote by county, starting with Dr. Young.
Jane Young, aye.
Dr. Cole,
Dr. Cole, aye.
Raul Labrador. Commissioner Tucker,
Mr. Tucker, aye.
Elmore County Representative Blanksmore,
Bye.
Valley County Commissioner Hasbrook.
Aye.
Okay, that motion passes, and I thank you folks and have a wonderful weekend.
All right.
Stand adjourned.
Yeah, would you vote for